A personality disorder, it's when a person really struggles in the world. They have disabling difficulties with their relationships with themselves and with the rest of the world. So their family, their work life, their friends. People of all ages can now be diagnosed with a personality disorder, but typically over 18 years of age. The common signs that might occur in a personality disorder tend to be loud signs, so quick to anger, impulsive, somebody that might engage in self-harming behaviours, risky other behaviours like drinking too much, fighting with people or becoming overly involved with new people. And then other signs that we commonly see are over-control signs, where people actually don't go into the world, they don't meet people, they don't want friends, they're very concrete in how they live. So signs can be very overt, or actually signs can be very quiet. A personality disorder can be linked with another mental health difficulty, such as anxiety, depression, or addiction, but we look for that and we treat that accordingly. Everyone's experience of personality disorder will be completely unique because we are all unique. So if somebody has a diagnosis of personality disorders, that disorder will be in the context of who they are as a person. A person should seek help if the struggle they're experiencing is pervasive, it's there all of the time. If you're a young person and you think you might have a personality disorder, talk to somebody you trust. Talk to an adult, preferably an adult that will listen to you, and together try and figure out who you need to go to next. As a doctor, it's your story, it's your narrative, it's who you are in the world. We want to get to know you. We can ask really specific questions because we have tools that help us to explore personality. And then with you, we will look at whether there is sufficient evidence to make a diagnosis of personality disorder. People with personality disorders can get help and they can have a life that brings them pleasure and meaning. The treatment options that are available to a person with a personality disorder are psychological treatment options. We do not recommend medication for treatment of a personality disorder, but we use medication to treat coexisting mental health difficulties. Self-care techniques are important for all of us. Self-care can be mindfulness-based practice, self-care can be yoga, self-care can be running, but self-care can also be meeting with your best friend and having a cappuccino once a week. The typical place for treatment of a personality disorder is within a psychiatric service. That can be in the outpatients, in the community, or as an inpatient for a short period of time here at St. Patrick's.
If you have questions about young people's mental health, you should visit the Walk in My Shoes website, walkinmyshoes.ie, or contact the Support and Information Service from St. Patrick's Mental Health Services.